And I want to explain when you get the comparison of plans, what are you looking at? So of course the name of the plan is right up here. The first line is your premium. The line in red is your number if you had no subsidy. Then we start going into the details. So the deductible is the amount that you're going to pay as a deductible. If there's a family, it's double. It doesn't matter if there's 5 people in the family, it's double. The maximum out of pocket is the maximum that you're going to pay out of pocket. I'll explain that in a second. The network that you want, HMO or EPO, or if there was a PPO. Your primary care copayment, and then your specialist copayment. If there is for RX any deductible, then that would be over here. And then on generic drugs, if there is a copay, that would be there. And now we get into some stuff that have that percentage on there. So outpatient, in this situation, we have a 25% after the deductible. So after $1,500 has been met, then you're going to pay 25%. We're going to look at something else in a second, in a minute. Emergency room, the same thing. So let's say you had to go to the emergency room and you're going to spend in the hospital, we'll go down to the hospital stay, 3 weeks in the hospital. So you're going to pay 25% after $1,500 have been met. And then the maximum that you're going to pay is $7,800. So it caps at $7,800. That's the maximum out of pocket. So it doesn't matter if you're going to be in the hospital for a month and the charge is going to be $20,000. The maximum you're going to pay is that max out of pocket. Down here you've got a couple of other links that it's nice to look at. So if I'm going to go to the policy detail, it's going to show me a couple of other things. So let's look at office visit. If there was an option to go to somebody out of pocket, then it will tell you. So these plans are HMOs. So an HMO, it's 100% out of pocket before the deductible is met, and then after the deductible is met, it's also 100%. In other words, it's not covered. In network, it's $30 all the time. I'm going to go down to the hospital stay out of network. So over here, they basically say 100% full price to me is the same thing. After your deductible is met, out of network, there is some coverage for the emergency room, for the ambulance, but everything else, you got to stay in network, the way that goes.